Hi, I'm Dr. Rick Duplantis, and welcome to It's Your Health. Tonight's show is about low back pain. You know, man was never meant to walk in the upright posture, and as a result of it, we suffer a great deal of low back pain. I think second to the common cold, it's the most common reason why people see their family practice doctors for low back pain, and it can occur from many different incidents in situations. I've heard patients tell me actually in practice that, doc, I was just bending over, picking up a piece of paper, and all of a sudden my back goes out. And what's with that? And so, there are many different things that can trigger back pain. I had a couple incidents myself. Uh, you know, One time I was throwing my keys on a sofa and walking into the home, and my back went out. Literally found myself on my knees, crawling to my bed, and made life pretty difficult for several days. But we all, from time to time, will have backache, back pain. Maybe we picked up something too heavy. Maybe we fell. Maybe we were involved in an automobile accident and we strained our back. Many different reasons. It can happen working on the job, lifting up a heavy piece of equipment, and can cause back strain. But so we're going to give you a little information on back strain tonight, and we'll go to my slide presentation. Okay, they're going to cue up my slide program. There you go. We're talking about sciatica here, and looking at L4, L5, S1, and you can see a nice illustration of the sciatic nerve in this view. And sciatica is a inflammation of the sciatic nerve. A lot of times, in 90% of the cases, it can be due to a herniated disc with that radiating burning pain down the back of the leg. When you get this type of condition, of course, this is something that you should bring you to your physician. We're looking here at a contrast. It's a very good slide on a healthy disc versus the slip disc. And it's a very, very good illustration of what a normal disc looks like. And we look over here and on the other disc where there's pressure on that nerve, and we see that redness on that nerve root where it's pushing upon it. And that's a slip disc. It's actually a bulging disc. A slip disc is a misnomer, this terminology. But I just wanted to show you what this looks like on a slide. And low back pain, it's a fact of life. Just about everybody will suffer from it sooner or later. One of the main causes of back pain, whether acute or chronic, is low back strain. This is a very good illustration here showing an actual herniated disc. It's like a jelly donut, the disc. In the center of that jelly being the nucleus, or the center of the disc itself. These little fibers in purple around it, this is a annular fibers that protect the disc. Now they become weakened over stress and constant strain, and they have micro tears that occur. And then eventually one day it could be that picking up that piece of paper, that last fiber that's protecting the nuclear material gives way and causes herniation. So it's a very good illustration of that. And here we go again. Excellent view here of the three phases of a disc. We have a normal disc, and you look at the spinal nerve root, and it's nice, and the spinal cord and everything is in its place. We look at the nucleus, which is the disc material itself, and we look at the annulus, which is the protective coating around the disc in the first disc, and we go into the second one under the bulging disc, and you can see where there's a break in those annular fibers, those protective fibers that surround the disc material, and you see that redness, okay, on the side of your screen on that nerve root, and that causes an inflammatory reaction in the body. The muscles in that region tighten to kind of support that disc, to immobilize it. It's nature's way of trying to protect that disc from further movement, from further irritation. The body's a miraculous thing. And so here we go. Here, another one, disc herniation from a different angle. We see the nerve root compression, source of pain. And, we see these very important structures. As nerves stretch out from the spinal cord throughout the entire body, low back strain can cause pain in other areas than your back. Low back strain can be caused by extreme physical exertion, as we said. It can be caused by falling, bending or crouching repeatedly. Lifting heavy objects, if you're not in shape, will definitely cause low back problems. It can also be caused by emotional stress, improper posture, being overweight, out of shape, or sitting in the same position for a long period of time. Even a severe cough can result in low back strain. And I've seen people sneeze before and go down to their knees. They obviously had a disc problem to begin with, but that pressure, we call intrathecal pressure, that pressure within the spinal cord puts pressure on that disc, and it bulges upon that nerve root and causes severe pain. Now keep in mind that low back strain can't be blamed for all back pain. There are many other causes, like the slip disc we saw, the bulging disc, the fracture of the vertebra, pinched nerves, arthritis, even infections can cause back pain. Some of the low back strain will include pain and stiffness in the back, pain in the buttock and legs, often in the back of the thighs, pain that worsens when bending, stretching, or coughing or sneezing. These are symptoms of low back pain. Since some symptoms of low back strain are similar to those of more serious conditions, it's very important to get checked out by a doctor. Any numbness and weakness in your legs, especially changes in bowel or bladder problems, is a sign of cardiac-quana, a very severe condition, and it's emergent. It requires emergency surgery, immediate medical attention. To diagnose a low back strain, your doctor will put you through an exam. He'll put you through a neurological and orthopedic exam in the office, and then we'll use x-rays, MRIs, magnetic resonance imaging, and CT scans to further diagnose whether you do have, in fact, a bulging or herniated disc or disc protrusion. These extra tests may only be needed if your pain doesn't go away on its own or with conservative treatment. Resting, maybe therapy, and also chiropractic manipulation, can minimize this back pain that you're having. Low back strain can be a painful and depressing injury. Just think about it. You can't move. Every time you turn, your back grabs you. I've been there. I've had back strain. I've had my back go out on me, and it's not fun. I think this kind of helps me to relate to my patients, having had that condition in the past, and treat them, and makes me a better doctor in treating low back strains. But it will happen to all of us eventually by bending the wrong way or, and twisting our back. But the good news is that most cases will heal in given time. To speed the healing, you want to ice your back to reduce pain and swelling as soon as you injure yourself. Now, I always use ice, and I use it 20 minutes on, 20 minutes off. I like ice a lot because, number one, it numbs the area, and you feel the coldness rather than the pain. And also, it's an anti-inflammatory. It decreases the inflammation in the back and the muscles and minimizes swelling of the tissue. You want to do it for 20 to 30 minutes every 3 to 4 hours for about 2 or 3 days. You can also ice your back after physical activity. Something I do pretty much consistently is I ice my joints after I train. After a workout, I'll go home and I usually fix myself a protein drink, and then I'll put ice packs on the shoulders. If I train shoulders that day, I'll put ice packs on my elbows, tennis elbow conditions from the past, and tendonitis. And if it's the knee that particular day, work the legs, I may put ice on the knee to decrease the inflammation. You want when to apply heat. Well, you can apply heat to your back, but only after about 2 or 3 days of icing it first. You want to use heat on your back after the initial swelling has gone down. Sometimes people want to use heat right away, and I tell them use ice initially. You want to ice the joint that you strained or the muscle that you pulled. And if it's your low back in this particular situation, you want to ice the low back. And I like those nice, large lumbar gel packs. They really are nice. They do a great job in covering the entire area. You can put it in your recliner, but don't recline. You don't want to bend the spine. You don't want to flex the spine because that will put more pressure on that nerve root. You want to kind of sit upright, maybe in a firm chair, but comfortable, where your posture is good, and maybe place a small throw pillow in your lumbar spine to put that curve back in your spine. You find yourself feeling a lot more comfortable that way. Another thing is sometimes, these back supports are very effective. Something about compression. Doctors will wrap your extremity with a compression ACE bandage, and you don't have as much pain. They'll wrap an ankle or a wrist or even a knee. I've used compression on my elbows when I train at times because it minimizes pain and also keeps the area warm while I'm training, and it reduces the occurrence of injury that way as well. But wrapping something is very effective in reducing pain. There are other things you can do. Like I said, after initial swelling has gone down, you might want to use a good hot soak. I like moist heat over dry heat because you get a greater penetration of the heat into the muscle, into the region of the back that's causing a problem. Here's a nice slide on disc herniation. The pressure of the disc material putting pressure on the nerve root as it comes down the spinal canal. They're drugs. Your doctor might recommend, your medical physician may recommend non-steroidal anti-inflammatory drugs we call NSAIDs, like Advil, Aleve, Motrin, naproxen. This will help with low back pain and the swelling. These drugs have side effects. The analgesics, if you're taking, the NSAIDs, Advil, the ibuprofen, or even the naproxen, long-term use over 2 or 3 months of this type of product can cause kidney issues. So you really need to be aware. And for short-term use, they're okay to take, but always check with your doctor. Go back to your family physician for those type of questions. They do have side effects. They should be used only occasionally and under your doctor's specific instructions. Prescription painkillers and muscle relaxants are sometimes necessary if you're in acute pain, and all the conservative methods have not addressed this. Massage is good for the back. Massage therapy would be another thing that you consider if you're having neck or back pain. Sometimes that will release the tension in the muscles. It will relieve some of the tightness and allow the muscles to relax. So that's very therapeutic in and of itself. You don't want to stay in bed when you have a back problem. In days gone by, doctors would put somebody to complete bed rest when they had a heart attack or anything. Everybody was ordered to complete bed rest. But that's the wrong thing for someone with a back injury or back strain. Do not stay in bed on the couch all day. It will make the condition worse. You want to maintain good muscle tone in your abdominal and lower back muscles. These are preventive measures. If you've got good, fit, toned muscles, you're less likely to get back problems. Also, I want to add to that, proper body mechanics, lifting properly. I always tell people, keep your nose between your toes. Align your body up with whatever you're picking up. Get as close to it as you can, and bend your knees. Lift with your legs, not with your back. No matter what people will tell you, bed rest doesn't work. People used to think that the best treatment for low back strain was to lie on your back until you felt better, but studies have shown it does not help. In fact, after taking it easy for a day or two, you should usually start light physical activity. The first couple of days when you can hardly move, and every time you turn, you feel like somebody's just grabbing your back, or a knife is stabbing you in the back. That's a very painful period of low back strain, or when you throw your back out. So be careful. This is a very good slide here, showing the vertebral body. It shows the spinal cord, the nice spinous process, and it shows the facet joints. A lot of anatomy here of the lumbar disc. Once the back pain is gone, your doctor will probably want you to start a regular exercise routine. And I always put my patients on a routine of stretching. I like the McKenzie exercises because they're very effective in treating low back pain. This will help you get your muscles stronger and more limber. It'll keep you loose. It will help you recover and reduce your odds of low back strain in the future. So your doctor will more than likely prescribe proper exercises and give you instructions on, swimming is very good, stationary bike, because you're able to work those muscles, increase the blood supply to the spine and the lower back, and these are all very helpful. You know, I like to tell patients, and if it's the warmer months and they've strained their back, to go get in a swimming pool and start walking in a pool, because when we get in a pool, it allows us to unload that disc. But I mean, we have the weightlessness effect, you know, when we're in water. And so that helps to reduce the pressure upon the disc, and it becomes easier for us to walk in the water. Walking is good for us. Exercise, movement is very good. So whatever you do, don't rush things with a low back problem. You know, don't try to return to your previous level of physical activity until you can move easily without stiffness as you did before your injury. Okay, and like I said, I've been there many times. I've thrown my back out after moving furniture, and I've never thrown my back out when I train at the gym, because all of my movements are predicted. It's when you don't predict a movement and you twist your back in an odd way, and it can happen putting on your socks or tying your shoes. Believe me, it does happen. You know, I've seen it happen. I've had it happen to me, and these incidents occur. You know, when you want to return to activity when you feel no pain, when you bend, twist, or walk, run, or jump. Now, if you start pushing yourself before your low back strain is healed, you know, you can end up with a chronic back pain and permanent injury. We don't want that to happen. So how do you prevent low back strain? Well, here's some tips to help you to avoid back strain. If you feel any low back pain during physical activity, you know, I tell my patients, listen to your body and stop. You know, when I'm training in the gym, I always listen to my body. I know the difference where I am working in muscle and the difference between when I'm stretching the muscle beyond its capacity and I'm injuring the muscle. So, you know, listen to your body. If you feel low back pain within a day of stepping up your workout, take it easy for a few days. You know, and I always do that. And I tell people that I train with, you know, if you start to feel pain come on in your low back, you know, and you're handling heavier weight and you've bumped up your weight and your intensity, come back down for a couple of days. Not to mean that you can't go back to that level, but you want to come back down and start training moderately again. You know, get your back in shape. You know, exercise, stretching your back muscles regularly is very good for preventing low back problems. Avoid sleeping on your stomach. You know, tell my patients this all the time. Sleep on your back or your side, or wedge a pillow underneath your legs with a bend in your knees. You know, but sleeping on the stomach causes the iliopsoas muscle to traction down. That big iliopsoas muscle is attached to the vertebra of the low back, the bones of the low back, and attached to the femur. And when you lie in that face down position, it kind of tractions down on those vertebrae. It causes a great deal of pain. Trust me, I've woken up, you know, at times with back pain in the morning from sleeping on my stomach. Has happened to me. You know, we change our positions every night. At least try to go to sleep, if you're cognizant that you're sleeping on your stomach, you know, in your sleep, you know, your light sleep, turn over on your side or turn over on your back. You know, when picking up something heavy, always bend the knees. Like I said, keep your nose between your toes. Don't bend from the waist and pick it up with your back. Lose weight if you're overweight. If you're overweight, it can put you at predisposition for low back pain and strain. Adopt good posture. Sit straight in chairs with your back against the chair's back. These things will minimize any problems with your low back. You know, and you know, you don't want to prolong pain, and you don't want to get back to where you're having problems again. You know, as I mentioned, you know, scientific research and studies, these studies have shown that chiropractic treatment with spinal manipulation, or chiropractic adjustments, also as they're called, and therapy has been shown to be effective in treating low back pain. And these are double-blind studies that were done by the Rand Corporation, showing that chiropractic care was more effective in relieving back pain. And, you know, this is a very effective tool. When choosing a doctor to treat your low back pain or neck pain, you want to look at their credentials, as their educational background, their experience in treating back pain. Choose wisely. Always choose your doctor wisely that's going to care for your low back pain. You know, I hope you know, these slides have given you an insight of what the the low back actually looks like. We've got some great pictures here of the lumbar disc. Here's a great picture of the herniated disc. It shows that nucleus pulposus, the actual disc material, pressing upon that nerve, that painful compressed nerve. As you can see, it bulging on that nerve. Causes of low back: uncomplicated back pain, strain, sprain, contusion, degenerative joint disease, loss of articular cartilage, the osteophyte, the spurs on the vertebra, the articular surface irregularity. All these can impair joint function at times. It can lead to inflammatory processes in the low back. Okay, I hope this has been informative. Like I said, many people will suffer from low back pain. I've had low back pain. I've thrown my back out. The important thing is to do the sensible thing. Take care of yourself. Ice it. Keep moving. Kind of stretch the back. Don't overdo it. As the back starts to feel better, using the ice 20 minutes on, 20 minutes off, 3 to 4 times, every 3 or 4 hours like that. That process, it'll help the back. The ice numbs that area of the body. And then after 2 or 3 days, a good hot soak, getting in a whirlpool bath will do wonders for your back. And then, the stretching. And if, these simple things don't help your back get better, and you can always see your doctor for this condition. And that would definitely rule out anything more serious causing your low back pain, because there are other things besides strained muscles that can cause back pain. And there can be more serious reasons for your back pain. So back pain doesn't go away within a certain length of time. You need to do something, and you need to go see your doctor, let him check you out, make sure that your back pain is not something more serious that needs immediate or medical attention. Okay, so let's take care of our backs. Let's exercise. Let's keep our abdominals tight. Let's have strong lumbar muscles as well. Walking is very good exercise to strengthen your back. Stretching, exercise in the gym. Always use proper form. Never try to handle more weight than you can in the gym, or when trying to pick up something at home, piece of furniture or whatever. Always get help. Don't strain your back by overloading your back beyond your capacity to lift something. It'll strain your back each and every time, and you don't want to have that type of serious injury. I'm Dr. Rick Duplantis. I hope these points have helped you. I hope this information has been of value to you. If someone you know has back pain, please tell them about this video clip. And I hope you've enjoyed this program tonight. I'm Dr. Rick Duplantis, wishing you a very pleasant good evening. God bless you.